Hi, I'm Gavin Harris with the Region 4 SITREP. First, to Nigeria, where the Lassa fever virus outbreak continues. As of the most recent official report released by the Nigeria Center for Disease Control and Prevention on the 9th of February, there have now been 1,913 suspect cases, of which 413 have been confirmed, and 80 have died since the beginning of this year, which equates to a case fatality rate of 19.4%. This is higher than the case fatality rate at this point in the year in 2024, which stood at 17.5%. Young people ages 21 to 30 continue to be the most heavily affected demographic, and in positive news, no new healthcare worker infections have been reported in the past several weeks. However, the late presentation of cases to medical care continues to remain a challenge. Next, to Tanzania, where an outbreak of Marburg virus disease was declared on the 20th of January in the northwest Kagera region. Since that declaration, there have been 2 confirmed and 8 probable cases, all fatal. This marks a case fatality rate of 100%. Importantly, according to the WHO, all 281 known contacts of these patients have completed a 21-day quarantine and monitoring without evidence of additional transmission. On the 28th of January, a safe and dignified burial was performed for the last confirmed case. Given that one case was in that of a healthcare worker, the source still remains unknown, the high case fatality rate, and concerns about delayed detection and isolation, national and regional risk remain high, though international risk remains low. Teams continue to closely monitor the situation. And in encouraging news, the last patients in neighboring Uganda's Ebola Sudan virus outbreak have been discharged from hospital. On the 18th of February, the WHO reported that all 8 patients that remained hospitalized had been released following negative testing. Monitoring is still underway for over 200 contacts that are quarantined throughout the country, but at this time, no secondary transmission has been detected. This was Uganda's 6th Sudan virus outbreak, and as of now, there have been 9 confirmed cases and 1 death in that of a nurse. The case fatality rate of 11.1% is much lower than prior outbreaks and likely a result of the swift Ugandan and international response from WHO that included a rapid vaccine trial and deployment of therapeutic medical countermeasures. And lastly, to the subject of this month's Project Echo session, H5N1. In the United States, as of this week, there have been 68 total confirmed cases in 11 states, with additional cases pending confirmatory CDC testing. None have been reported in Region 4. Most infections have been occupation-related among workers exposed to infected poultry or cattle, and there's been no evidence of human-to-human transmission. On the 14th of February, the U.S. Department of Agriculture did give conditional approval to a new bird flu vaccine to be deployed in poultry. Healthcare workers are advised to remain vigilant and obtain early and appropriate testing of patients with consistent signs and symptoms of influenza. Rapid subtyping, especially for those critically ill, remains essential. And finally, there have been no reports of suspect or confirmed patients with special pathogens of concern in Region 4 at this time. For more resources, visit us on the web at scdu.emory.edu.